what you are choosing. So this is about the indications. Again, in stage 4, is there a role for radiation in stage 4? Definitely yes. So this, how many of you have heard about the word oligometastasis? Have you heard of this word? Are you aware of this concept? Right. So what it means is, once there is a metastasis outside the region, outside the organ, it is called stage 4, right? So previously all the stage 4 used to be bundled together as one subset, assuming to have poor prognosis. Then what they discovered is there are actually a composition of two different sets of patients in this stage 4. One set of patients who are having only metastasis, that is 3 metastasis, 4 metastasis or 5 metastasis. So less than 5 metastasis versus more than 5 metastasis. So the less than 5 metastasis group, even in stage 4, if you treat them aggressively, let us say there is a single brain metastasis, or let us say there is a single lung metastasis, you see, you do a PET, there is no disease anywhere else. They are technically stage 4, but there is only lesion in 1 or 2 places. So they try to treat these patients aggressively with local treatments also, like surgery or radiation, aggressive radiation. So what happened is they realized these patients do much better than patients who have diffuse metastasis. So there come the concept of oligometastasis versus diffuse metastasis, even in stage 4. So in RT in stage 4, diffuse metastasis, we know bone metastasis, to treat the pain, to prevent a fracture, radiation has a definite role. And brain metastasis, and another thing is fungating metastasis, fungating mass with bleeding. If it is patient is fit, you can try and treat those local metastasis aggressively, either with surgery or with high doses of radiation along with systemic therapy. The patients carry a much better outcome, both in terms of symptom and in terms of, probably in terms of survival also. So this concept I want you to understand. There is the notion called oligometastasis in stage 4, which carry a better prognosis, which are treated with more aggressive local therapies, right? So these are some of the trials showing the survival advantage, like not very relevant for this particular discussion. So last slide, how do we give radiation? How many days we used to give radiation? So if previously the traditional treatment used to be 5 to 6 weeks of radiation. Then like if you see the relative questions asked by different trials in surgery, radiation and chemo. In surgery and radiation, most of the trials, the aim will be to see whether you can treat with lesser surgery, whether you can treat with lesser radiation. Whereas in chemo, it will be in the opposite direction, whether you can add more drugs to increase 1% more, 2% more. So this is the general trend of how the trials are designed. So in radiation, we started with 5 weeks of radiation. Then we tested whether the same treatment can be given in 3 weeks. Yes, the results showed they are equal. So we started treating with 3 weeks. Incidentally, when COVID happened, every week we have to give a letter to the patient for them to travel out of the lockdown areas. So we had an incentive to make the 5-week treatment into 3-week treatment. So now it is 40 grain, 15 fractions. 3 weeks is what we usually give. Now there are trials which show 1 week of radiation, equivalent doses of radiation delivered over 1 week. If you see the numbers will be less, but the duration will also be less, which is something similar to the dose-dense chemotherapy that Sarah was talking about. You give more treatment in lesser time, so that if you take that 40 grain 3 weeks, what is the dose given in 1 week? 40 will be 3, can you guess? I don't know. Something around 12, 13 grain. Here we are giving 26 grain 1 week. So that is equivalent to 40 grain 15 weeks. So all these schedules are equivalent for the patient. So imagine a patient going 5 weeks for radiation from one place to another place versus 1 week, which is logistically more convenient with equal ontological outcomes. Other than that, but there is a insurance issue also. I think madam will be knowing. Some insurance companies reimburse not for the treatment package but for the treatment number of days. So we will treat one patient with 50 gray, one patient with 40 gray, one patient in 3 weeks, one patient in 5 weeks, because what the insurance company says, that we have to follow. So there is a practical issue. Whoever is treated in CM scheme will know. So that's about the radiation schedule. That's it. Thank you. I don't think anyone will have doubts in patient. Thank you, sir. Thank you, sir.
Thank you, sir, for that insightful session. We now move on to